meetings in Europe, some of the investigators of an Asian heart failure registry met with the leadership, and we realized that we don't have any single organization in our country which would address the need, educate the patients and the doctors about applying appropriate therapies. And then after coming back, after discussing with some of our colleagues, we formed this association just over 3.5 years ago. The stated objectives were not only we create public awareness, but most important, we tell our doctor colleagues as to what is the right method of applying therapies which have been proven by different guidelines in different associations. Because often we find that the therapies which are given, the medicine may be given, but it is not given in adequate doses, and therefore a person is unable to apply or derive total benefit from it. Also, many times people are not aware would benefit from some of the advanced therapies and their knowledge also, and also afford a large number of doctors working in our country to attend these meetings, interact with them and resolve their doubts. It also afforded us an opportunity that European Society of Cardiology started hosting our association in their joint sessions, in European sessions from the first year onwards. It gave exposure to some of our cardiologists to present their work and also their free papers, etc., which were accepted. And therefore, it is important for upgrading their knowledge and to be recognized on international stage also. And thus it has continued. The first meeting was held in Delhi when we took baby steps, and we were just about 120-25 people in that. Last year was the second meeting in Hyderabad, which was considerably bigger. And this year, I'm sure Dr. Uman and Dr. Sundar have done a great job. And we expect close to 500 people from across the country and speakers from different parts of the world, as Dr. Sundar has highlighted. The object is to have a free and...
In India, the coronary bypass surgery, the heart surgeries that are done, and the great work that the cardiologists do in angioplasties is the same or better than the best centers anywhere in the world. At Apollo, we have done more than 150,000 coronary bypass surgeries with outstanding results of 99%, which probably only 2 or 3 centers around the world have that type of results. But what's most important is, it is not the, for a patient, yes, he wants a great care that is available for him anywhere in the world, but he also must say, I can afford it. This is where I think we brought the cost not $50,000. When we started in India, heart surgery used to cost $3,000 to $4,000. All other hospitals which started today, there are at least 100 to 150 very, very good hospitals, not just centers. Our costs are a fraction of the cost, international costs. So I think this is where people must, sometimes they say, oh, it's very expensive. It costs 3 lakhs, 4 lakhs. But you must compare that they have done what they could have done in US or UK or Europe, better results, and at probably 10 or 15% of the costs that occurs to them. So I think coronary disease is increasing. We all know there's a huge tsunami which is going to hit us. It's hitting us already. That's called the NCDs. And the chief of those NCDs is coronary heart disease. There are many, many, many words to say. It's a very dreadful thing, the coronary artery disease which we are facing in our country. Just now, if I come a few minutes late, I ask for your apology. A friend of mine called me and said, my grandson went for a business to Hyderabad, and he had chest pain. He went to the hospital. He was the president. 27. So in 86, when I presented this 30-year-olds, 8 patients who had heart disease, they said, Dr. Reddy, Indians don't know the date of birth. I said, don't be foolish. They not only don't know the date of birth, they know the stars under which they are born. So anyway, they didn't even then get into their mind. But in 82, they realized that 6 doctors didn't get up from their duty rooms. All are in their 30s. All 6 of them are Indians. Then, by God, today we know Indian heart disease is different from the Caucasian disease. So when we talk of the coronary artery disease, we come to saying that if they present themselves early, they can do an angiogram and remove the blocks. Or if they come still, there are excellent facilities across the country to do the outcomes Our results are better than the best centers anywhere in the world. But our cost, as I said, is probably 10% or 15% or even lower than that, so that many people could afford this, many organizations could sponsor this. So I'm particularly happy when that beyond, for example, in cancer, we're getting patients in stage 3, stage 4. That's why the best centers in the world, whether it is Sloan Kettering or MD Anderson, Tata Memorial Hospital, or Apollo or other hospitals, we all have that what's called 5-year survivals very low, because they have come too late. If they have come early enough, we can do a robotic surgery, send them home next day, the tumor removed, and they'll lead a normal life. This is what I want you all to support, the prevention, earlier awareness, because these NCDs are going to be the biggest problem the nation is going to say. Whatever the government, even yesterday's budget, it was very encouraging and is going to